An increased number of disabled and elderly population enters skilled nursing facilities because they can't care for their own health care needs. This is one of the major factors driving up the cost of health care. We need innovative ideas to support keeping these folks in the comforts of their own homes and reverse this trend.
Hello, I'm Anna Jones's primary care physician. I've been taking care of Anna for the last 15 years. She is now 78 years old with a relatively complicated medical history. Anna's diagnoses consist of diabetes, cardiomyopathy with congestive heart failure, hypothyroidism, visual impairments, and depression. In the early years, Anna managed her medications well and lived comfortably and safely alone in her home. However, with her increased visual impairment and subsequent increased depression, medication management has become more difficult and problematic. Anna has had several hospital admissions over the past several months. All her hospitalizations resulted from her confusion with her medication compliance. After each hospital discharge, Anna was visited by the home health agency. The nursing staff successfully taught Anna how and when to take her medicines. The visits were no longer paid for by her health insurance once Anna demonstrated she could take her medicines correctly on her own. However, because of her visual impairment and increased depression, Anna's ability to properly care for herself is compromised. Loneliness and seclusion augment the problem. Most recently, Anna confused her Lanoxin, prescribed every other day, with Lasix, which was taken twice a day. Anna's daughter came to town for her monthly visit with her mom and immediately rushed Anna to the hospital in acute congestive heart failure. As a primary care physician treating many elderly, I constantly face the dilemma of how to maintain my patients in their own home and preventing medication errors and noncompliance.
Secure TeleHealth supports the initiative to keep people in their homes and out of nursing homes. We use video conferencing to increase the number of contacts between clinicians, case managers, and therapists and their clients. Hi, I'm Jim Mountain from Secure TeleHealth. Today I'm going to show you how you can love and care for your clients through a computer screen without ever leaving your office. We install a computer appliance and an internet connection into each client's home. The client never has to touch the appliance because it's controlled by the case manager on the other end of the phone. During today's demonstration, you're going to see a split-screen video. This is an example of a recording file that we make with clients' permission. This recording file can be shared with other health professionals for treatment purposes. The file is stored and transmitted securely to maintain client confidentiality at all times. The following is a simulation of how Secure TeleHealth can enhance and supplement traditional home health delivery.
Hello.
Hi Anna, this is Jan from the Visiting Nurses. Is it okay if we have our daily scheduled telehealth visit now?
Oh, that would be fine, Jan.
Thank you. Would it be okay if we recorded our visit?
Yes, that'll be fine.
Great.
I will go out to the screen now.
Okay, thank you. Good morning, Anna. You look nice. It's nice to see you up and dressed this morning.
Oh yes, and I've had my breakfast, so I'm all ready to take my medication.
Well, great. I understand that Margaret from the Community Health Care Center is calling in today also.
Yes, she is. I'm glad that I don't have to go out, because I'm always afraid I'm going to slip and fall and break my hip. You know, like my neighbor.
Oh, I know, Anna. I'm glad I get to stay inside also. It's great that we can do this through the computer. Well, let's go ahead and start. Let's start by taking your blood pressure.
Do you have the cuff and monitor right there?
Yes, I do.
Okay, go ahead and put the cuff on. Oh, that looks good. It looks like you have it about a ½ an inch up from your elbow, and I can see the blue line. Go ahead and hit the start button on the monitor. And you hold that in front of the screen. Great, I can see it just fine. Your numbers are registering. It'll just take a second. Have you been having any trouble with the monitor, Anna?
No, things have just been fine.
Well, that's great. I can see it really well. Thank you. Great. Your blood pressure is 107/60 and your pulse is 75. Good. I'll be sure to let your primary care physician just know how well you're doing. Okay, you can take that off and set that aside. And when you're ready, we'll just start with your medication.
Do you have your trays with you?
They're right here.
Good.
I'll just put this aside.
Great.
Would you check your first medication, please, and hold that up? Up a little closer to the camera. Oh, great. That's your Amaryl. Can you tell me how you take that medication, Anna?
I take one a day.
That's right. So you can go ahead and take that medication now. Okay. How about your second medication?
What do I do with this now?
Well, you want to go ahead and put that in the tomorrow tray.
And then you want, good, you put your Amaryl in the tomorrow tray, and then you want to get your next medication.
All right.
Just a little closer. Great, that's your Lenoxin. Can you tell me how you take that medication, Anna?
I take one in the morning and one after dinner.
No, I think you're confusing that with your Lasix.
That medication you take every other day, and since you took it yesterday, you should be putting that in the tomorrow tray. You don't need to take it today.
Oh, okay. So I put this in tomorrow.
Right. Okay, let's see your third bottle.
Okay, that's your Lasix. You can go ahead and take that now. And remember, you take that again this evening, so put that back in the today tray.
I take it again
You
tonight.
take that again this evening after dinner.
Okay, Anna, you should have one pill left. Would you hold that bottle up?
Okay, that's your Zoloft, and how do you take that?
I take one a day.
Okay, then you can go ahead and take that now. Good, then you can go ahead and put the Zoloft in the tomorrow tray.
Okay, I don't take any more of these.
No more today.
Okay.
Well, thank you, Anna. It looks like we're finished. What time is Margaret, your case manager, calling in today?
Well, Margaret's visiting about 11:30, but she always calls first before she turns on her screen. You know, like you do. She'll be happy to hear that I took my medication today. Margaret is going to make arrangements for me to visit with my therapist, and then she's going to make arrangements for transportation to the bank and the grocery store.
Oh, that sounds great, Anna. Thanks so much. You have a great day, and I'll check in with you tomorrow. Bye-bye.
Hi, Anna. It's me, Margaret, your case manager. How are you?
I'm good.
Good. So I hear that Jan, the home health nurse, visited earlier today and watched you take your pills. Did you take your Zoloft?
Yes, I took all my pills.
Wonderful.
Zoloft was my last.
Excellent. Okay. So I'm going to call the Medical Assistance Transportation Program because Wednesday we need to make sure that you get to your mental health therapist visit, the bank, and the grocery store. How does that sound?
Sounds good, as long as it's not too much to know.
Okay. So what's new over there? What's going on?
Secure TeleHealth, enhancing communication between case managers, clinicians, and clients. Secure TeleHealth.